Hello and welcome to the fourth webinar in the series brought to you by Strengthening the Heartland. We are a collaborative that is focused on bringing you information about opioid misuse prevention. So we're really happy to have you joining us today. I'm Amber Letcher. I'm the director of this project. And before we get started, I just want to remind you that you will receive a survey at the end of the presentation, just asking you for some feedback as well as ideas about future webinars. We really value that feedback and hope to get that from you. So you'll receive a link in an email following this live version. If you are watching a recording, you'll have access to that link as well, just in the same place that you found this recording. Also, throughout the presentation, if you do have questions, we really encourage you to type those into the question box, and then I will relay them to our speaker at the end of the presentation. And with that, I will introduce our presenter for today. She's a familiar face. The presenter for our very first webinar, Dr. Jenna Londgren, is from Minnesota State University, Mankato, where she's the coordinator of the Alcohol and Drug Studies program. She's going to talk about a topic in a little bit more detail today, and we're really excited about it because this topic was actually requested by some of our previous viewers. So welcome, Jenna. We're happy to have you.
Thank you so much, Amber. I'm really happy to be back. And thank you all to be viewing this morning. I'm speaking to you today from Minnesota, and unfortunately it's a snowy Minnesota in April, so I hope that you are all staying safe and warm. And the awesome thing about webinars is that you can view them in a place that's convenient for you. So I'm happy that you're listening today. All right, so today we're going to be talking about a topic that is really new. I think most of you have probably heard about the drug fentanyl. I think all of you are probably aware that there's an opioid crisis happening. So what I really do want to talk with you about today is what is fentanyl, kind of what is the history and the context of it, what are some things that I think is important that you know about it, and then hopefully in the end, sort of why is this important, what does this all mean? But before we get started, I want to briefly let you know my relationship to the topic, a little bit of my experience, and kind of what I'm seeing in my work. So as Amber said, I am the program coordinator for the Alcohol and Drug Studies program at Minnesota State University, Mankato. So what I do is I train students to become alcohol and drug counselors. So my students work with people with addiction, and business is booming. And I hate to say that, but since I've been here in about 4 years, our program has more than doubled. All of my students get jobs right away. And I think a big reason for that is because addiction is only on the rise. It's absolutely growing. Addiction and mental health issues are becoming more and more complex and interrelated. And also a big part of that is also due to the opioid crisis. So I think a lot of you know that we are facing this opioid epidemic. Just to kind of remind you of these stats, that we are losing tens of thousands of people every year. So along with my work training students to become counselors, I also work in an addiction treatment center. So I lead groups and I see clients just to really keep abreast to these issues. And again, we can't talk about this crisis without talking about this drug called fentanyl. And that's what I'm going to be talking with you about today, is just what's the history, the pharmacology, what is it like when someone overdoses, and then how are people getting it, what are the policies surrounding it, and kind of hopefully what does this all mean to you. So fentanyl is very much related to the opioid crisis. It's a huge contributor. This is one of the biggest trends that we're seeing. So we know that, you know, in the 70s, we went through a heroin trend as well. And every heroin addict started with heroin. And now in this current crisis, we know that people are starting with prescription meds, moving to heroin. And now we have this other drug that's being in the mix. It's called fentanyl. So 4 in 5 users now start with prescriptions. And what happens again with this drug, with heroin, with all opioids, is you develop a really rapid tolerance. So you need more to get high. You need more and more and more. And all of a sudden, you aren't even getting high anymore. All of a sudden, you are only using to prevent withdrawal. So what we've been noticing is that fentanyl is a really, really, really potent opioid. And it is being mixed in with heroin, and users are flocking to it. Um, so fentanyl and fentanyl analogs are creating a lot of overdoses, and that's creating, deaths. So I just want to give you this chart, kind of outlining drug overdose deaths in America. So I think a lot of presentations on the opioid epidemic talk about 2016, there's 63,000 people. 2017, it's up to over 70,000 people are dying of drug overdoses. And if you notice this chart, notice that 2014 bump. That sharp increase is fentanyl and other synthetic opioids. And that bump is what we'll be talking about today, kind of the sharp increase in fentanyl and what are all the facts surrounding it. So just again to kind of give you a context of where fentanyl lies and other opioids, there's opioids that are classified as natural, semi-synthetic, and then synthetic. And I just have a quick slide. So natural opioids are derived directly from the opium poppy. An example of those are morphine and codeine. So natural does not mean healthy. This does not mean organic and non-GMO. This isn't something that's necessarily desirable, but it mirrors the molecules of the opium poppy. Semi-synthetic opioids, heroin, oxycodone, hydrocodone, a lot of the prescription meds are classified as semi-synthetic. And that means that it mirrors the opium poppy, but then we have other molecules added. And completely synthetic opioids, examples are methadone, fentanyl, and then fentanyl analogs. So I'm going to really quickly go back to this chart. So again, looking at the light purple line, it says fentanyl and other synthetic opioids, and that's minus methadone. And I just wanted to clarify that because methadone is a type of drug that's used to treat heroin addiction and fentanyl addiction. So I just kind of wanted to clarify that even though it's classified as a synthetic opioid, it's not kind of wreaking the same havoc as fentanyl and these other synthetics. So we're going to talk about kind of how these came about. So again, just what is fentanyl? Just the most basic question that some of you might not know the answer to, and I know I didn't before I looked more into it. What exactly is it? Again, we're hearing about it in the news. We know that it's a danger for first responders. We know it's really powerful, and this is what it is. It's a synthetic opioid. And again, I think this idea of synthetic is really important because this is where we can become innovative chemists, right? So we can have a molecule and we can, manipulate it to make it more stronger and powerful and more effective as well. But in some ways, it's a little overwhelming because drug laws and drug policies can't keep up with that. Because if you make one thing illegal, you tweak a little molecule, and it's now a legal substance that's essentially the same thing. So fentanyl itself, it's 100 times stronger than morphine, and it's 25 to 50 times more powerful than heroin. And I think that's very compelling. If you think about heroin, you think about how strong that is. If you've known a heroin addict or work with heroin addiction, you know that heroin is a powerful drug. And to think that this is an opioid that's 25 to 50 times more powerful, that just has a lot of power to it. So it's a Schedule II drug. So that means that there's some danger, but we're still kind of showing that it's useful in a clinical setting. And it is widely used in the hospital and for, medical purposes. It's used for the treatment of pain, a lot of times for end of life pain. A lot of times it's used for cancer patients and just other kind of chronic pain issues. And what's cool about fentanyl is that it has a wide therapeutic index. So what that means is that there's a wide range where it's really safe and it's really effective. And I think that's also important to kind of ground ourselves in that, is that fentanyl is not a bad drug, that no drug is bad or good. I don't want to value drugs at all, is that drugs are simply chemical molecules. And when they become bad or good is kind of based on the context in which they're used, and the purposes and things like that. And, again, kind of the outcome is bad or good. But there's a lot of good outcomes for fentanyl. again, it has this therapeutic index where it's very, very essential for people who are dealing with a lot of pain. And I think that's important to remember. If you suffer from chronic pain, or if you have a loved one who does, or if you've ever kind of sat with someone through cancer treatment, that this is a really, really valuable, addition to medical technology, is that this is a blessing to have, a treatment that is safe and effective that people can use as they suffer from pain. So again, I think how we view fentanyl a lot of times can be like, this is bad, we need to ban it, but there are a lot of good uses for it. All right, so I'll talk a little bit about the history as well. So it's still a relatively new drug. It was first synthesized in 1960. It was used in Europe and other countries for years before it became FDA approved by the US. And now again, it's become a really frequently used analgesic. So it's used again to treat pain. And I also want this idea of pain treatment to kind of be an underlining theme of this topic and the opioid crisis in general. That what this does is it relieves pain. And I think, again, kind of why is this important and why are so many people want overdosing is kind of the seeking relief of pain. And again, we'll talk more about that. So just more of the history. In the 1950s and kind of the mid 50s, morphine and meperidine were two drugs that were widely used to treat pain. So meperidine, I don't know if many of you have heard of that. That's a synthetic opioid. It's purely synthetic. So both of those, again, they're widely used in clinical settings. These were the go-tos. But both of them, what Janssen was realizing is they had a slow onset. So they couldn't easily penetrate the brain. So it took a while, and it just wasn't as effective as Janssen thought that pain relievers could be. So he developed a pharmaceutical company out of Belgium, and what he did is instead of working with the morphine molecule, he and his team worked with the meperidine molecule because they saw that it was a lot more straightforward. It was a lot simpler. So throughout that time, for years, they kind of added and took away from these molecules. They developed dozens of different types of drugs. And what they did is they wanted to create a drug that's more lipid soluble. So what that means is it's a higher fat content that can penetrate the blood-brain barrier. And again, what that does is it has the drug work faster, a faster onset, a more rapid onset, and it's more effective. So you kind of get more of the bang for your buck, to put it, very clinically and medically. But what they're wanting is a lipid soluble drug, so it can hit the brain faster. So in 1957, they created a molecule that's called phenoparidine. And phenoparidine, again, as we are, these synthetic chemists, we up the ante. So we start with opium, we go to morphine, we go to heroin, and again, this synthetic phenoparidine is more potent than morphine. So all of a sudden, they're realizing that this new chemical structure, much more lipid soluble, more rapid onset, and kind of more effective for treating pain, and that's what they were wanting. So this phenoparidine it was synthesized again, and it was patented, and it was used outside of the U.S. And as I've been researching this more and more, the FDA is a little bit slower moving than other European countries. So they're more careful in kind of what they approve and what we kind of distribute and use. Another interesting thing to note that was during this time in the 1960s, to create and patent a drug cost about $75 million. So it was relatively cheap compared to what it is now. So now from kind of beginning to end, it's about $1 billion in this day and age to kind of create and patent a drug. So again, 50 years ago, it's 75 million, and now it's up to $1 billion. So I think that they just kind of they had this space to be a little bit more innovative, I guess, and they had kind of the money to do that as well. So fentanyl was first synthesized in 1960, and this was kind of branched off of this phenoparidine molecule. And they're realizing, again, it's very, very lipid soluble, very, very powerful. And again, now it's about 100 times more powerful than morphine. All right, so anesthesiologists, what they were doing is that they were really, really trying to figure out how to use these medications in surgery. And this anesthesiologist named George De Castro, what he was interested in is developing some sort of anesthesia that was stress-free. So a lot of times when patients were in surgery, their stress hormones would be activated, right? So their heart would beat faster, they'd release cortisol. And De Castro was interested in how do we create a medication that can block those stress responses because they don't want the heart to beat faster. They don't want all of these hormones being released into the blood. So it was, it's an interesting idea. A lot of us don't think about that. So a stress-free anesthesia, because a lot of patients, a lot of kids, it's scary to go into surgery. And there's a lot of anxiety and stress involved with that. So what he did is that he found that large doses of intravenous fentanyl, so direct, like inserting it directly into the blood, could provide that stress-free anesthesia. So again, it blocks the stress response. And that was a really kind of breakthrough in the field of anesthesiology. So in the 1960s, it's enjoying success and popularity in Europe, but it was really difficult to get FDA approval for the US. And there was one kind of really well-known anesthesiologist named Dr. Robert Drips. And he was the one that was really putting his foot down. He's saying, this is way too powerful. He was worried about the abuse potential. So Janssen himself, I think this is really crazy. Janssen himself, who's the CEO of Janssen Pharmaceuticals, this is a Belgian company. It's used in Europe and Africa and South America. He meets with this one man personally, and they really had this negotiation. They had this discussion, and they agreed that fentanyl could only be approved in the US if it was in combination with droperidol. And what that means, essentially, the mix of those two drugs was about 50 to 1. So 50, elements of droperidol, and then 1 element of fentanyl. And it was called Inovar. And I think what's crazy about this is that after this meeting, the FDA did approve Inovar, which is the mix of these two drugs. So I think what I get from that is just, it's so fascinating to me how, literally one person who's really opposed to getting this drug through, once Janssen sort of convinced him, then the FDA approved it, just in this one form. And I think what's interesting about this is that both of these two men knew that droperidol gives a really bad high if it's taken as a recreational drug. So both of them really believed that mixing these two drugs would really, really kind of minimize this abuse potential. So again, looking at that ratio of droperidol to fentanyl. So it was approved in 1960 by the FDA. It's used in the US, but only in this form. But 4 years later, fentanyl became available as sort of this standalone drug. So in the 1960s, cardiac surgery itself was still really in its infancy. So they didn't have a lot of innovative techniques. A lot of patients died in surgery. A lot of patients would go into cardiac arrest. And at the time, what they did is they used really, really high doses of morphine. But still, what they were finding is that it wasn't as fast acting, that stress response was still happening when patients were in surgery. And again, if you're in cardiac surgery and that stress response is being activated, that means your heart is beating faster, right? So what they realized is that fentanyl, again, if fentanyl could block that stress response, this could be a really, really important alternative. So that's what they found, is that fentanyl was used in cardiac surgery, and this made the drug really take off. So it's legal in the US, it's being used under this context, and in a really important way. It saved a lot of lives, and it really helped anesthesiologists and surgeons perfect cardiac surgery. And it really, it blew up sort of. So the sales, they said the sales increased tenfold the first year that the drug was off patent. And that's pretty astounding. And what they found again is that this is a drug that was really easy and inexpensive to produce. So a lot of different pharmaceutical companies were kind of making generic forms of it. And it's really popular because they realized how effective it was. And again, I think that's important to understand is that it has an important role in surgery and in medication in medicine, and it's not just used for illicit purposes. So the Janssen company has kind of been the people who are looking at opioids. So they're the ones who, once we have fentanyl, now they're kind of wanting to develop other analogs. And these are just kind of other drugs, other opioids related to fentanyls. And this is where they started to develop these things called super fentanyls. And I think a lot of you might have heard of carfentanil, and that's an example of a super fentanyl. It's like people are taking these elephant tranquilizers, that's carfentanil. And the Janssen company developed these. And again, it's used for like wild elk and moose and elephants in the DART form. Literally, they're injecting these animals and they're sedating them, which also has this important role in veterinary medicine and things like that. So they're realizing that fentanyl is taking off and is developing in this really important way. And they're again kind of upping the ante. So all of these synthetic drugs, they're getting more and more creative, they're getting more and more powerful, and they're being used to sedate larger and larger mammals, essentially. And they're also looking at other forms of administration. So, you're not necessarily going to shoot a patient with a dart. That would be probably pretty wild and stressful and unsettling. So they're looking at ways that individuals can get fentanyl into their system. And we'll talk a little bit about that. So some of you might have heard of the fentanyl patch. So it's called transdermal. So it's given to patients through their skin. And this is still really new. And I think I'm kind of struck by that this topic is just really new. And I think it is kind of hard to keep up with, how this is related in a medical sense and in a clinical sense and things like that. So what they're finding is that transdermal fentanyl was a really effective way for patients with chronic pain. Again, this isn't for acute pain, this is for chronic pain. And that's just an important, differentiation to make. So for chronic pain, the patch was the way to go. So what it could do, it could create a steady blood level of fentanyl. And with one patch, patients could be relieved of pain for days. And that again is really, really valuable. So what they found is that the sales in 2004 exceeded about $2.4 billion. And this isn't people who are abusing it. This is people who have a medical necessity for their pain relief. But with any drug comes a potential for abuse. So now what some people with addiction will do is that they'll take the patch and they'll take it apart and they'll literally take a syringe and suck up the gel and directly insert that into their veins. So there is a potential for abuse, but typically it's used in a really effective way to treat cancer and other chronic conditions. All right, this is an interesting one. So it's called transmucosal delivery. And this is a lollipop. And I don't know if any of you have heard of this either, like a fentanyl lollipop. So I read an article that's called The Fentanyl Story, and it just kind of outlined all of this information. But when the Janssen company was really promoting these super fentanyls, someone had the idea that why don't we try giving this carfentanil, so this really, really strong sedative to monkeys in the form of sugar cubes, because they knew that monkeys love sugar cubes. So again, it's not as stressful as like shooting them with a dart. And they're not having the monkeys overdose. That's the other thing. When we talk about these animal studies and drugs, I'm like very unsettled by that if they're like having them overdose. But they're just trying to find, again, like this therapeutic index. and this delivery method that's, non-invasive and almost kind of enjoyable, maybe. So they found that that was a really effective way to sedate monkeys, is to give them this like liquid carfentanil in sugar cubes. So what that did is it made these anesthesiologist researchers think about, how do we deliver fentanyl in a way that's not as stressful, especially for little ones, and to kind of relieve that anxiety. So they started out with this literal lollipop. It was called Oralette, and that really actually wasn't a commercial success. It was developed, and it was the Janssen company. They kind of convinced them to market it and patent it. And it was used a little bit, but it didn't explode. It didn't completely, hit the market, and it's not like this groundbreaking thing. But what they did is they kept going with it. And if you see these pictures at the bottom, I think that's important to be able to kind of picture that. But it's called Actic, and this did become a commercial success. So this was much more recent, and it's not just for children. This is also a treatment for cancer pain, and it's literally an oral delivery. So you get it through your mouth. And they wanted to kind of tone it down with like the childlike delivery of it. So they made it a little bit more medicinal. But it's not as it's much less evasive, essentially. It's not a shot. And it's kind of the user is in control of it, which is pretty interesting. So that's just another form that fentanyl is delivered. And this is how that idea was sparked by these poor test monkeys being used for everything. So in the past 10 years, they're really understanding that fentanyl is popular, that it's effective, and they're trying all of these different ways for patients to ingest it. So now they have nasal sprays, they have tablets, they have what's called a soluble film. So it's something that you can kind of orally put in your mouth, almost like an LSD type thing. Not that all of you are like, yes, when I use LSD, that's exactly how I took it too. But that's just kind of what it made me think of. But the point is that there's a lot of different methods of administration. And that when that Actic, kind of that lollipop-esque form, that's this oral administration, when that became a really big commercial success, a lot of other companies are kind of jumping on the bandwagon and figuring out these really innovative ways to administer fentanyl. All right, so I just want to talk a little bit about the pharmacology, just to kind of let you know kind of how effective it is, essentially. So basically, pain relief can occur really, really quickly after it's administered. 1 minute, that's fast, that's super fast. It penetrates, it gets into the bloodstream, it penetrates that blood-brain barrier, and pain relief really, really quickly. So in other kind of the transmucosal delivery systems, that's about 10 to 15 minutes. Again, if it's not going directly into the veins in the bloodstream, it's not as quickly, but it's still pretty fast. And then the sublingual and the intranasal, it's 5 to 10 minutes. So what's really important to know about this, again, is that it's a very small dose that creates relief. Really, really small dose. So they say about 0.2 nanograms, which is tiny. And then it has a relatively long duration of action. But it's important to understand why that small dose is important, because we'll talk about why such a small dose is needed for people to overdose as well. And I have a picture to kind of show that lethal dose too. So that, that analgesia, right? So that pain relief can occur at a very small dose. All right, so with any opioid, these are the effects of it. It's called a downer, right? A narcotic, that it's not Adderall, right? It's not cocaine. It's not going to make you, it's not meth. What this does is it slows down the central nervous system, and it produces pain relief, first of all, fatigue, sedation, and all of these different effects. And again, it depends on, if someone is, they call it opioid naive, or if they're opioid tolerant, it's going to create different effects based on, how much you've used in the past and things like that. And then again, in higher doses, it creates unconsciousness and respiratory depression. And that's essentially how people overdose, is that their brain doesn't tell their body to breathe, so they stop breathing, and that's where, again, we've had a lot of issues with overdoses because of respiratory depression. All right, so illicit fentanyl. The history is important to understand, and I can't say enough that fentanyl has played a really important role in medical, in surgical, in anesthesia technology. It's a very important drug that has helped us hone in on some really important surgical processes. But with any drug, there's always going to be this abuse with any drug. So illicit fentanyl is what typically gets talked about in the news. So most illicit fentanyl originates in China. And whether it comes directly from China or if it goes through Mexico and then into the United States, that's where it originates. So what we're finding is that it's a lot cheaper than heroin. It's a lot cheaper. They say a typical user can spend about $100 a day on heroin. $100 a day is gonna, make them okay. And they say that for $100, you can be okay on fentanyl for up to 3 weeks. So that's huge, right? That it's just a little goes a long way. So this is very much a current issue right now, is China and illicit fentanyl, because what they're realizing, and I have a screenshot that I found online, is that people can order it online directly from China, which again is insane. That's so crazy. The internet has made, just the availability of all of these drugs so, I guess, just readily available, right? With a Google search, you can order drugs right to your door. So what's interesting is, when we talk about these synthetic drugs, that dealers can tweak the formulas. So even if we ban certain molecule structures, they can tweak it a little bit, and then they're kind of bypassing that law. So an example of that, in China, they had this drug that was called U47700. And they said, okay, in July of this year, that specific formula, the specific drug, is banned. So again, in July. So what online dealers did is they said, everything must go, buy through June. You can buy this U47700. So again, it's like, it's clearance fentanyl. And that's, because this specific molecule is banned, they sell out their supply and then they tweak it, and all of a sudden they have a new supply. Um, the other thing, I think this is a pretty overwhelming, to be honest, if we're talking about limiting supply, because this is almost impossible to do, literally. If you think about the US Postal Service, what they literally check packages by hand. It's people checking packages. And if you think about how little fentanyl is needed, we're talking about a product that's like a tiny bit of sugar, a few grains of sand. So again, limiting the supply of it just seems like a really, really kind of losing battle, to be completely honest. And that's where I feel like it's pretty overwhelming. And a lot of online dealers do prefer US postal mail as opposed to other, like FedEx has automated processes to kind of check out different packages. So they use the good old US Postal Service. So what's interesting again is that you can Google this and you can buy it, but the feds have kind of been onto that, right? So they don't want to make that easy. But a lot of people use what's called the dark web, and they use private browsers, and then they can pay in what's called cryptocurrencies, which is also a really kind of cutting edge way to exchange money. And that makes it nearly impossible to track, right? So it's the dark web, it's private browsers, it's cryptocurrency. So again, like I said, it's really overwhelming to me when you think about wanting to seize and limit the supply of this tiny drug that's very addicting, that there's this huge demand for in our country. Um, all right, so again, just a little bit more on that. They say that, um, one user I looked at just, an interview with someone who buys their fentanyl on the dark web, and he said he was noticing, a little bit of a crackdown because he said one dark website had thousands of suppliers, thousands of suppliers. And he said that now that one was cracked down on and it was now made illegal. But he said the one that he uses is called DreamNet, and he counted 300 different suppliers of fentanyl, which again is a lot. It's not thousands, but it's still hundreds. And again, I still think it's really hard to kind of keep trying to chase that. So what we're finding is that most fentanyl overdoses are occurring in the eastern part of the country. So in New Hampshire, in Maine, in Florida. There's a documentary, I think it's called Death by Fentanyl, and it followed first responders around. And while this documentary is filming, there's an overdose that happens. And one of the first responders said that during one shift, he had over 20 overdoses just in one shift. So in these eastern states, hundreds of people are dying a day sometimes. And that can be based off of, a specific batch. There's a lot of different reasons for that. But really, really kind of, especially in the East, they're finding that these overdose deaths are spiking. So overdose has been happening again, kind of since as long as fentanyl has been around, but it's increasing now more than ever. So I want you to take a look at this picture. So in this picture, this is depicting a lethal dose of heroin and a lethal dose of fentanyl. Look at this, you guys. Look at that, like seriously, it's about 3 milligrams is enough to kill an adult male, a normal sized adult male. Look at that dose. It's insane. Again, when I say overwhelming, it's like we're supposed to find that in packages by hand in the US Postal Service. It's really, really a small dose needed. So again, when we're talking about overdoses, kind of what is the current trajectory is that most users are starting with prescription pills. And again, if you're interested in the opioid crisis and how this all happened, I did do another webinar called just Opioids 101, how a crisis was created and why you should care. But users were starting with prescriptions and then going to heroin. So as they're using heroin, a lot of times it's laced with fentanyl, because if you look at those two, you can't tell those apart. So fentanyl definitely improves the potency. And a lot of drug dealers don't even know if it's cut with it. Drug users definitely don't. If you buy a bag of heroin, I don't know if any of you have bought heroin off the street, but it doesn't come with nutrition facts. It doesn't come with, here's exactly what's in this product that you're buying in a really shady bag off the street, from this drug dealer. So users don't know what they're getting. And to be honest, a lot of times they do not care what they are getting as long as it'll get them high or get them out of withdrawals. They will take anything. They will do anything. So again, a lot of times the fentanyl itself is impure, or the heroin is cut with it. And I think that's kind of an important differentiation, is a lot of times heroin users overdose because it's been cut with fentanyl and they did not know it. So even their high tolerances cannot withstand this powerful drug. And other users knowingly and willingly use fentanyl as their drug of choice. And again, I think that's important to understand, is that they're seeing a lot of heroin cut with it. And it's a lot. And what's interesting about kind of this, what's interesting about this epidemic is that sometimes drug dealers will specifically create an overdose. They want someone to overdose because that's a marketing technique. Because, intuitively we would say, oh my gosh, this created an overdose and a possible death. We would want to stay away from that. But what users, when they hear about an overdose, an individual who's addicted to an opioid wants that batch, okay? Because what they think is that the user who overdosed wasn't hardcore enough, but they are hardcore enough. They want the batch that will almost kill you. They say, a user themselves said it's like hitting gold to get fentanyl in heroin. It's like hitting gold, because all of a sudden they can actually, feel something and get high from it. So again, it's really interesting. So in Minnesota, what we've been noticing is that it's the heroin is coming from Chicago to Duluth. Duluth is having a huge issue with that. And that again, it's laced with fentanyl. Their heroin is laced with fentanyl. Um, what I think is really interesting when we say East Coast is that if you look at what I provided is a map of the Mississippi River, and they say east of the Mississippi, the heroin is powder. So they say that the fentanyl is really, really easily mixed in with that. They also say it's issues related to, lack of treatment services, lack of prevention, sort of this rural, close-knit community where a lot of times using as a social event. But they say that east of the Mississippi, the heroin is powder, and west of the Mississippi, they say that it's black tar. So again, what's interesting about that is that fentanyl is always white. It's always that white powder. So if they can mix it in with black tar, they're like, whoever can mix in fentanyl with black tar heroin is going to be a billionaire. Um, Even though we do know that it is already being mixed in with it, but it's just not as easily mixed in as with the East Coast powder. So hopefully that can kind of clarify like what's up with the East Coast. Um, so one of the responses to the opioid crisis has been with naloxone. And I think that's a really, really, really super important um, innovation and just kind of way to combat this. This is an intervention that's been working. So when we hear about, 70,000 people in 2017 died from an accidental overdose, we also know that tens of thousands of people have been saved and have had overdoses reversed. And what's interesting is that most of these reverses are done by amateurs. They say only about 20% of overdoses reversed are done by first responders. And this is a big way to combat the crisis is that if someone is overdosing, they're administered naloxone or Narcan, if you've heard of Narcan kits. And this again is an intervention that naloxone is now available at every local pharmacy. Kits are being passed out in high use areas. At our university, we have what's called an opioid symposium every year, and we have opioid, essentially Narcan trainings, right? So people come in, they teach our students how to reverse an overdose, how to watch for it, how to diagnose it, and then they pass out Narcan kits, which I think is so important and so awesome. So a lot of amateurs themselves are carrying it. Users themselves are saving their friends. Another thing, so they talked about how black tar heroin is harder to adulterate, but it's still, even when they use fentanyl testing strips, they're finding that about 2/3 of the heroin is cut with fentanyl, even black tar heroin. And this isn't like a big empirical study that's showing that. That's just like an organization in LA just had their users themselves test their own heroin with these fentanyl testing strips, and they were still finding about 2/3 was laced with it. So to combat the crisis, again, it's administering naloxone. It's making this drug really, really widely available. But that's a very short-term solution. This is like the don't die solution. And what they're finding is a lot of times if someone overdoses, even if the overdose is reversed, they go to the ER, they're kind of, their vitals are looked at and they're just kind of checked over physically. But then a lot of these places don't have a follow-up plan. My sister's a nurse in the ER in Wisconsin, and she just says, they see this all the time. And if someone, they reverse the overdose and then they just let them go. Like there's not a lot of services in place. Okay, let's get you into treatment. Let's get you a bed somewhere. And that's, again, the naloxone is just a very short-term, like don't die solution. And then again, the fentanyl testing strips are becoming more and more popular. They're just given out to different users in high use areas, so at least they can know what they're getting. If they're buying heroin and it's laced with something that they don't know about, that's where at least they can test the purity of the product, and it can test positive for fentanyl. All right, so this is our lovely president, Donald Trump. So this is very, very like just a few months old, is that China and Trump have been meeting. The president of China, they've been a little bit defensive, which I think is interesting. They're just like, you know what? Like it's not our fault, right? But they have had a little bit more lax penalties for, you know, kind of these drug sales. So I'm literally, I've given you a Donald Trump tweet. Like this is how we've gone from medical journals, you know, providing my data to a tweet, which I think is kind of interesting. Um, but but China, it has agreed to crack down on, you know, people who are selling. So I don't think the death penalty is going to be effective, though, to be completely honest. I think that the demand is so great, and where there is a demand, there will be a supply no matter what. No matter what. So, how China does it right now, there's all of these labs that sell it directly to the US. They also sell it directly to Mexico, and that's another trend that we're seeing. And this is also really new, is that a lot of the cartels, um, I think it's a New Generation Jalisco is one of them, and Samoa or something like that. I'm not totally up to date with my drug cartel knowledge, but it was 2014. 2014 is when the heroin cartels started cutting a lot of their heroin with fentanyl. And again, if you go back to my that chart that I showed you of when fentanyl overdoses or when like that really spiked, it's directly related to the Mexican cartels cutting their heroin. It's in 2014, and a lot of the other cartels have followed suit. So the trend in that is really saying, oh my goodness, this could actually replace heroin. Is that this really cheap synthetic drug is actually, it might put some of the heroin dealers out of business and the people who produce the poppy. And Mexico is a really, you know, beautiful place for producing the poppy, and that's where a lot of the heroin comes from, is Jalisco, Mexico. It's, you know, a really good climate for growing it, and it's a huge, you know, it's a global commodity to supply heroin to the US and to other places. It's they make a lot of money for it, and especially if it's in an impoverished country. So again, they say to have China crack down, and China has agreed, but it's really, really hard to do. All right. So another thing that I want to briefly talk about, and I don't want to open up a big can of worms, but I totally am, because now I'm going to quick talk about chemical warfare. Um, but this is another trend related to, you know, fentanyl analogs that I do want to mention because I think that it's really important. So there is this issue in Russia in 2002. It's called the Chechen rebels, and it's kind of this branch of individuals. They stormed a theater and they held more than 800 people hostage for 57 hours. Horror situation, totally horrible. So they didn't know what to do. The Russian troops did not know what to do. The rebels said that they wired the place with bombs, that they were wearing suicide belts, these 800 lives. They literally, like, they were at a loss. So what Russian troops did is that they released this mysterious gas in the air. It killed all of the rebels. But what it also did is it also killed more than 120 of the hostages. The Russian troops never disclosed what was released. So all of a sudden, dozens and dozens and dozens of people are being brought to the emergency room. Like it was a horrible, horrible tragedy when this happened. They were just throwing bodies into, you know, ambulances and bringing them to the hospital, but they didn't know how to combat it because they didn't know what was released. So what they realized later, and again, Russian troops never disclosed this, but after like an hour of doctors trying to treat these patients, they realized that naloxone would work, and it would reverse this overdose. So what they realized later, only years recently after testing the blood of some of the survivors, is that the gas was carfentanil. So what we're talking about is that this is getting to be really serious, how powerful this is. And that just a single terrorist attack with this gas, again, carfentanil is a fentanyl analog. It's the one that's an elephant tranquilizer. It's 100 times more potent than fentanyl. So again, we're just upping the ante more and more and more. but this has some implications in chemical warfare. Just to, help you rest easy today. I'm so sorry. But I just think it's a really interesting thread and trend related to fentanyl, is that this again is how powerful this is. So what's important to understand, in reversing an overdose is that more and more naloxone is needed. So even if you administer one dose of naloxone, it might not be enough to reverse the overdose, just because these fentanyl and its analogs are becoming so potent. Another interesting thing that I only realized after attending a Narcan training is that an individual can go back into an overdose after taking the drug. So if you take fentanyl and you overdose and you receive a dose of Narcan, it can reverse the overdose, but the drug itself doesn't leave your system. So you can go back into an overdose even after receiving naloxone. So what's really important is, if you do help someone and administer this dose, to stay with them, because they can go back into an overdose because the chemicals are still in their body and their brain. And it's the individual who leads the Narcan trainings that I attend is in recovery herself, and she's overdosed about 7 times. And one time she went into an overdose 3 different times without taking more of the drug. So it's just important to remember, again, with these really, really powerful opioids, more and more naloxone is needed. All right, so just kind of talking about just how to treat fentanyl addiction. And I honestly think that this could be, with any opioid addiction, this could be its own seminar, just talking about medication-assisted treatment. But it's really important that individuals detox first, so that they're not going into a treatment center, really having these cravings and withdrawals, and just to make sure that they are medically detoxed. It's a pretty brutal detox. It's like flu-like symptoms, but it's some psychological terror in understanding that you won't be able to have your drug anymore. But people in withdrawal and who have detox say it's like a really, really bad flu, throwing up, fevering, vomiting, just skin crawling. And then again, a really, really important way to treat fentanyl addiction is with medication-assisted treatment. And that's with synthetic opioids as well, like methadone, buprenorphine, Suboxone, naltrexone. All of those are synthetic opioids that are replacement therapies. So what they do is they help people who are addicted. It helps alleviate their cravings, so their brain is leveled out. It's very controversial still, but in combating this crisis, people are saying we have to do whatever works. If people's brain can be, leveled out and balanced, and they can return to the workforce, and they're not, obsessed with calming their brain down looking for their drug, it's a really important intervention to continue to fund and to continue to promote. And then again, with any other co-occurring disorder types of addiction treatment, and that's kind of my forte, inpatient, outpatient, understanding these underlying issues with mental health therapy. All right, so in closing, I'm kind of looking at the time. It's really important just to kind of educate people about even, how their heroin can be laced with fentanyl, how they don't know what they're getting when they buy drugs, how, a lot of times their drugs can be cut with other chemicals. It's just important to understand even things like using a clean needle, right? Syringe and needle exchange programs. Those are absolutely growing, but just these bloodborne diseases that people are like contracting because they're not using clean needles, to educate them to never use alone. That's one thing that an amateur user, if you use alone, there's a high likelihood that if you overdose, then you'll die, because no one can help you, So a lot of users now do have naloxone kits, and they are saving each other, right? 80% of the time, people are being saved by their friends and by the people they're using with. So again, even just education, like never use alone. This is very, very harm reduction, right? But I think it's important too, of just kind of understanding why we have this huge appetite for pain relief. Why are we in pain? Why are people, using elephant tranquilizers to not feel anything and to become numb? So for me, I always think about starting at home with my own children. I have 3 kids, and helping them have the ability to form connections, right? Because if you can form connections to people, that helps you feel more connected and less isolated. And if you can talk about your feelings and talk about your issues, and if mental health and addiction can really be destigmatized, people don't feel as much shame and they can talk about it more openly. So just again, I feel like I could talk for a long time about that, but to really think about how you can make a difference with your own home, with your own clients, with your own work in your own community. And then again, really destigmatizing addiction itself, and advocating for these harm reduction techniques. That people's lives are being saved with naloxone and with clean needles and with treatment, and pushing for funding instead of prison. All right, again, I'm going to stop now because I'm looking at the time and I want to leave some time for questions. But I'm more than happy if you want to contact me via email. If you have questions, I know that this PowerPoint presentation will be emailed out as well. So if you want to look back at the data itself. But otherwise, I think we'll open it up for questions.
Yes. Thank you so much, Jenna. So much information, but so interesting to hear kind of the background. And like you said, we could talk about this for a long time, and we will continue to talk about it through other webinars, of course. If you do have questions, please feel free to type those into the question box. We've got a few minutes here, so I'm happy to take your questions. Or if something comes up later too, of course, I'm sure Jenna will be willing to answer those. As we give just a couple minutes here, I just wanted to remind you that you will receive a survey link. We'll value your feedback. And even if you have filled out this survey before, please do it again, because we do collect information on each individual webinar. So let us know if you're interested in some of that, maybe medical assisted treatment information or any other topics that you might want to hear more about. We do have one question here. I'll read this to you. Is there a talk therapy treatment that you found effective when working with individuals who have more of an opioid addiction?
To be honest, I think it's really important. I have worked with opioid addicted patients before. And a lot of times they're a little bit out of it, to be honest. Like it does impact their brain. So what I found really effective is just kind of mindfulness based techniques where they can sit with their feelings. They can use kind of those non-pharmacological approaches to being in the present and being with their body and noticing different types of pain. So I'm a huge mindfulness advocate and sort of like the DBT-esque types of interventions. But that's what I work with a lot. So I might be a little bit biased, but it's just sort of like sitting in their feelings, accepting their feelings, noticing them and letting them pass, and just sort of having an insight instead of just this really strong desire to not feel or to be numb, if that makes sense. So mindfulness-based techniques are my go-to that I have found to be effective. And it's, again, just to remind them that it's a skill to practice it. It's not like it just comes automatically. It can be really distressing to do, in the beginning, especially if they have a lot of shame regarding their addiction and all the loss that they've incurred. But to really sort of sit with their feelings and accept them, and to, not judge themselves and things like that.
One more question here. Do you have any advice or experience working with maybe the dental industry? So dentists who also prescribe opioid related medications? Any of them who?
I don't have experience working with the dental industry, but I do know that they have kind of really kind of cracked down on their prescribing of opioids as well. My only tidbit that I talked to a dentist at a wedding for like an hour because he was a dentist. I'm like, oh my gosh, what do you like? How has the opioid crisis impacted you and things like that? But I know that their prescribing they're receiving a lot more education. And again, this is very anecdotal. a wedding guest at a wedding from last summer. But it was fascinating to talk with him just because, for a long time they prescribed opioids like candy too. So they're receiving more education. And I do believe that they're also having to register in a portal, just so it's tracked a little bit better. And so their patients are tracked to see if they're kind of double dipping with other prescribers as well. But that's about all I've got. It's so interesting how many different industries are impacted by this, from law enforcement to dental to ER to lawyers, teachers. It's everyone is impacted by this. So
Um, there will take a couple moments here in case there's any last minute questions. I do want to thank Jenna again. Wonderful presentation. And we will be doing more webinars. We're trying to do them about monthly, maybe bi-monthly. So please be watching for those announcements. I would encourage you to register right away when you see them, even if you don't know exactly if you'll be able to attend the live webinar. But if you're registered, you'll get that recording automatically. So please feel free to share those links. And with that, I don't see anything else, but we thank you for your time and have a great day.
enjoy the snow.
Yes.
Take care.